And welcome back to this conversation about COVID-19 and communities of color. The vaccine rollout is underway. It's slow going, and it could be some months before most of the U.S. gets inoculated. So, Dr. Limon, share a little bit more about the importance of people getting tested if they feel sick.
So the importance of getting tested remains the same as it was before. You want to get tested so that you can appropriately isolate yourself if you are infected and not infect others.
And then, Dr. Henderson, the tests are much more widely available now, but there's still some barriers when it comes to Black and brown communities getting them.
Yes, it depends on the access for testing. There's been some studies say if you live 20 minutes from a testing facility, worse outcomes. So transportation is an access, and also to know where to get the test. So you have to inform the communities of color where to get the test, but it is a barrier.
And let's talk about masks. The CDC recently saying doubling masks because we have these new variants offers more protection. Dr. Hamlin, your thoughts?
So double mask is fine. The main thing is the message is the same all around. Being without a mask in front of or with people that are outside of your family. The only reason I'm here with no mask on is because I'm in a room by myself where I've locked the door. And I think that it's important to frequent hand washing, soap and water or hand sanitizer, and really limiting your exposure as best you can. And so for some people that means they're working from home. For others, it is that they are, staying home as often as possible and not socializing or congregating with people who are outside of those that live in their house.
And Dr. Livingston, the best type of mask to wear and the proper way to wear it. A lot of times we see people with it below their nose, sometimes below their chin, sometimes not really tight. Let's talk a little bit about that etiquette.
Yes, so it is extremely important to ensure that your nose and mouth are covered with the N95, which is the best mask, and we wear that when we're standing face forward with a COVID patient. You have to get fitted for that because if there's air leakage on the side, it's ineffective.
Yeah, and we're still going to be wearing masks long after people get the vaccine, correct, Dr. Henderson?
Yes, correct, because there's still a chance even when you receive the vaccine that you can still contract the virus and you can still transmit it. So you still have to wear your mask after vaccination.
And a lot of hand sanitizing going on lately and a lot of hand washing. The preferred is hand washing though, right, Dr. Limon?
Correct.
Okay. Well, thank you very much. We have more to talk about later. We'll be right back.